Hi everyone, welcome back to my channel. My name is Dr. Kiruka Bridges. I'm an obstetrician gynecologist. I discuss everything about women and child health on my channel. Welcome back. Thank you for subscribing to my YouTube page. Thank you for following me on Facebook. Thank you for following me on TikTok, and also thank you for following me on Instagram. Thank you. Today I'll be discussing how uterine fibroid causes infertility. Just like we've said before, if you have not hit the notification button, please do that now. Subscribe to my YouTube channel. I have a lot of teachings that I've done on this. So just a follow up. Just like we've said before, uterine fibroid is an excessive growth of the smooth muscle of the uterus. It can contain connective tissues. It's a benign condition mostly, except if it undergoes what we call sarcomatous changes. That's when it becomes malignant. But that's mostly due at old age. Now, how does uterine fibroid cause infertility? Uterine fibroid is not a common cause of infertility. However, it can coexist with infertility in about 5 to 10% of infertility cases. When every other cause of infertility has been ruled out, and we can't say that this is the cause of this couple being unable to get pregnant, we can say that fibroid is the cause. We can now start looking at the fibroid as the cause of that infertility. And this happens in about 2 to 3% of infertility cases. So, fibroid is not a common cause of infertility. If fibroid is going to cause infertility, these are the methods, these are the things that have been postulated that how fibroid can cause infertility. Number one is fibroid on the cervix. When there is cervical fibroid, it may occlude the cervix, thereby making it difficult for the sperm cells to pass through to go and fertilize the egg. This will prevent sperm that is ejaculated through intercourse to pass through the cervix to enter the uterus and go to the fallopian tubes where fertilization happens. So that is one of the ways fibroid can cause infertility. The second thing is that if there is submucous fibroid, if you can recall from the previous teaching on uterine fibroid, we said there are different locations of where fibroid can be. So if there's any fibroid on inside the endometrium, that is the submucous type, the fibroid will distort the endometrium. Because of the distortion, it makes it difficult for the smoothness of that endometrium that is needed for implantation. So even if there was implantation, even if there was fertilization, it will be difficult for that fertilized egg to implant because the smoothness needed for that implantation has been distorted. So it may be difficult for implantation to happen. The second thing is that presence of big fibroid in the endometrium will cause a big distance. It will increase the distance the sperm had to travel. And so, if the distance is so much that the sperm cannot travel all through the distance before fertilization, the sperm may die on the way. The sperm may not be able to reach the fallopian tube where it will fertilize an egg before the egg gets back to the uterus to get implanted. So, this is another way that endometrial fibroid can cause infertility. Now, the third is if there is a fibroid at the conal end that is obstructing the fallopian tubes. It may be unilateral, it may be bilateral. So presence of uterine fibroid at the fallopian tube, it will prevent sperm cell movement to fertilize an egg. Even if an egg is fertilized, it may be difficult to get back to the uterus because there's a huge fibroid stopping the tubes, the entrance to the tubes where fertilization takes place. So that's another method. And there is that if there's a method, if there's a fibroid on the fallopian tubes that occludes the corneal end, so even if there's ovulation, the eggs will not be picked back to the uterus so that fertilization and implantation will take place. This is another way that fibroid causes infertility. Other ways include when there is presence of uterine fibroid in the endometrium. Don't forget that I said the endometrium is where the baby lies. So when there is that type of fibroid is called submucous fibroid. So when there is fibroid in the endometrium, the fibroid may tend to release some proteins that alter implantation. So, because of the presence of that fibroid in the endometrium, implantation may be difficult to happen, even if an egg has been fertilized. Then the next is that presence of endometrial fibroid, that is submucous fibroid, causes increased uterine contractility. What it means is that the uterus continues to contract. So even if there is presence of fertilized egg that is trying to implant, because of that contractility of the uterus, that pregnancy may not take place. So these are few ways that fibroid can cause infertility. It's also said to release some vasoactive substances and increased androgen levels. So it causes increased hormone level in that uterus, and even if there's a fertilized egg, the pregnancy may not happen. So these are common ways fibroid can cause infertility. Don't forget from the beginning that fibroids are infrequent causes of infertility. But if we have ruled out every other cause of that infertility and it's only fibroid that we can think of, we'll now start looking at that fibroid, especially fibroid that are greater than 3 cm and inside the endometrium. Fibroid in the subserosa, those ones outside, may not actually cause infertility except if they are occluding the tubes, that is the fallopian tubes. Now, the one intramural may just be a cause of infertility when it's disrupting the endometrium, especially the huge ones. These are the ways fibroid can cause infertility. That's when we have ruled every other cause of that infertility. And if you are managing a patient, if a patient is being managed for infertility and we can't find any other thing except fibroid, when we start looking at that fibroid, there are management options. We can go for laparoscopic assisted surgery, or we can go for open surgery. We can even do some high intensity focus ultrasound just on that fibroid. So if it's surgery, we go into the theater, enucleate the fibroid and bring it out. In the endometrium, we reconstruct it and put a catheter. That catheter is to keep the endometrium patent so it does not close and form adhesion, and the person will now start having problem with menses. So it may start causing irregular menses. And so we keep the uterus patent by passing an intrauterine catheter, small size catheter, about size 6 to size 8. We'll keep it there at least for 10 days. I'll place the woman on hormonal drugs. This hormone will help to regenerate the endometrium so that the endometrium will grow back. And most times, this fibroid, we don't remove it after ovulation. We remove it just immediately after the menses because we don't want to remove everything about the endometrium. We hope the endometrium regrows. Endometrium has layers. So these are ways fibroid can cause infertility. And if we're not going to do open surgery, we can do high intensity focused ultrasound, though costly, but it works. Just place a high thermal a high temperature on that fibroid using ultrasound, and we hope that with time the fibroid will shrink. We can do radiologically assisted using uterine artery embolization. You just knock off blood supply to that fibroid. These are management options for uterine fibroid causing infertility. Thank you for watching to this point. Please, if you have not subscribed, subscribe. Share this video to get to others, for the information is necessary. Then follow me on Facebook page at OBGYN Talks with Dr. Adazion. Follow me on Instagram at OBGYN Talks with Dr. Adazion. I'm also on TikTok at OBGYN Talks with Dr. Adazion. See you next time for enriching videos and teachings. We have other videos that I've already uploaded. Please, if you have not watched, watch, like, comment. Thank you so much.